Hi, I'm Cassidy Weber, and I'm here to talk about ER registration. I work at Anderson Mercy Hospital, and I work as a patient access specialist, or also referred to as a registrar. Today I'm going to talk about the emergency room process. Here I've listed 5 steps for the ER process. First step is checking in, second is triage, third is the treatment, fourth is registration/copay, and lastly is to be discharged. So when you first come to the ER, you're going to check in by filling out an admit form, asking the basic demographics like first name, last name, your social security, your date of birth, your gender, your reason for visit, and phone number and family doctor. The others listed, like work-related injury, is if you're going to file a workers' comp, and the female question, because we need to know if you're so far along that you'll be going upstairs to the OB floor. And the social security number, we ask that because that's the only indicator on there that won't be the same as anyone else's. You have your own social security number, so it's easier if we get that from people to look you up. Some people do disagree with putting it down, which is fine, but we always ensure people that they're shredded. So the patient will fill out this form, and they'll give us an ID and insurance card, so we can scan that into our system and have that updated. We do something called an EQA, which is just a quick reg of the main things that we have them fill out on the form, just so we can get them in the system and on our board, or Epic board. So after that's put in, an armband will print out and we'll verify their birthday and have them take a seat. Before they take a seat, though, we'll have them fill out consent forms for treatment that the hospital is able to treat them today. So once that is complete, they'll have a seat and the patient will be called back as soon as the nurse is ready for the next patient. Triage. So triage is when the nurse calls you back after you've been checked in, and she'll ask you a series of questions about why you're there, go over your medical history and your medications, and take your vitals. And if you need blood work for the reasons you're there, they'll do that. If they need to collect any urine specimens, they'll do that as well. And then they'll send all those out to the lab, and you'll wait for your doctor from there. If our hospital or ER is full, we'll send you back out to the ER lobby. You'll probably have an IV in your arm if you need an IV. And then we'll just wait for a room. But meanwhile, while you guys are waiting in the ER lobby or in your room, the blood work is going to the lab and the urine specimen is going to the lab. And if they ordered x-rays on you, that also is being processed while you're waiting. Okay, the treatment is when the physician we have nurse practitioners, physician assistants, and physicians. They will examine you and see where you would need to be treated further, or if you need any medications, like if you broke your arm, they'll have to get an x-ray, of course, first, and then they'll treat it by either putting a cast on you or sending you on your way with just an air cast until you get seen by the ortho doctor. Secondly, this is where we come in. This is the registration portion of this. So that EQA that we did in the beginning will now be turned into an ERA, which is the full registration. And the information that we collect is of course, your marital status and your address and your employment. And all this is important because, like, for example, your marriage. If you're married to somebody, we want to make sure your spouse or significant other is listed so we are able to contact them in case of emergency. Not only that, but it gets kind of confusing when we have different members coming in and trying to figure out who they are. If there was an emergency, just who we can send back and can't. Also with the employment, most people who are employed get insurance through their employers. So that's important, so we know your job, and also that's important for if you're filing workers' comp, because we'll need to know who you're employed by to be able to file through them. The emergency contacts are very important. A lot of people don't like to give a contact number just because they're afraid that we're going to just be calling them for no reason, or if that they're liable for the patient, which is not true. It's just an emergency contact for the patient if they ever, hopefully not, if they ever need them though. The patient's copay is collected after the insurance information is verified, which we have a system called RevRunner that does that. It will verify and it will give us information back whether or not they have a copay or not. Or sometimes it's also listed on their card. They're sometimes aware of the copay. And most insurance companies don't have copays. So. The final step is to be discharged from the hospital. So you've been triaged, you've been seen by the doctor, all the tests have been put in and resulted. Now goes over the discharge. The physician has reviewed everything and wants to give you your final reason for why you came in and to go over what you need to do from here. So upon the findings, they'll probably either admit you, which hopefully they don't, or they'll discharge you with a diagnosis and a plan. Along with that being discharged, they'll give you medication either in the hospital to take then, or they'll give you a prescription to go fill out when you leave the hospital at a pharmacy. The initial thing a physician usually says is that to follow up with family physician if you're not feeling well in a couple days, like if you're still seeing the same results, to follow up with them. Referrals are also given if the ER physician suggests that you see a specialist like an ortho, or if you're coming in because you're pregnant, to go see an OB, and so forth. And that is pretty much it. And that's how the ER process works. Thank you.